A man named Marcus has concerns that his mother, who is in hospital after having a fall, is not getting enough food, as she is unable to feed herself properly and will not eat unless encouraged to. After looking for more information on the subject, he gets in contact with a national charity working with elderly people. They discuss their common interest in the issue, and Marcus decides that he would like to work with them to develop a campaign. The issue that is identified is the concern that elderly people in hospital are not getting enough food to eat. The charity does some research and carries out a survey. It is established that 6 out of 10 older people in hospital are at risk of being underfed. They find that there is legislation in place providing guidelines on feeding the elderly, but that these are not being followed by hospitals. As the legislation is already in place, the target for this campaign is the National Health Service. A second goal, at a more local level, is hospitals themselves. The goal is to ensure that the legislation about feeding the elderly in hospital is followed across the whole country. The message and theme that is used for the campaign is "Hungry to be Heard." Marcus has already got support from a national patient organisation. This charity also works closely with other organisations concerned with the elderly, and they agreed to support the campaign. The action plan involves producing a practical guide for patients, their carers, and hospital staff about how to ensure that elderly people on the ward are eating enough. These are provided to the National Health Service and to a number of hospitals. A survey is used to assess the hospitals that use the leaflets, and there is 100% positive feedback. This enables Marcus and the patient organisations to advocate for their use across the country.